if you guys could possibly like comment on where you think things are going to be going forward. I want to hear, especially from Canada, Korea, and from America, is like, do you think that with US we're going to head into another surge because of a variety of different reasons, and we're going to have to slow down our practices privately, academically? Obviously, we're doing emergencies as well too. What do you guys foresee? And Canada too, you know, obviously shut your borders, done a tremendous job up there. It sounds like, you know, enforcing public health issues. What are your concerns going forward the next 6 months or so? And then Korea, again, model as far as a response to the COVID pandemic, but recently also having their own challenges. Appreciate you sharing that. So if each of you could just briefly comment on what your thoughts are for the next 3 to 6 months, that'd be great. Oh, I'll start with Yujong. Dr. Kim, why don't you start? Yujong Kim first, then Esther Kim, then Henry An, and then Jin Song, please.
I mean, I think that for the next 3 to 6 months for me, it will be probably more of the same. I did take a dip in the number of clinical patients that I saw and did and the elective surgeries, but my actual revenue hasn't reflected that, and I'm not sure if it's just kind of the lag in the billing cycle and whatnot. I mean, I'm definitely lower in volume, but after June 8th, we're offering both in-person visits and telehealth visits, and my elective surgeries are starting to really reach back at the level that they were. And of course, I take care of spinal stenosis, herniated discs. I don't do a lot of the big surgeries, so the patients are eager to get back in. And so I'll have to say it'll probably be more the same 3 to 6 months from now. So I don't anticipate anything hugely different.
Thank you. Dr. Kim, Esther?
I think it'll be interesting to see. You know, recently in California, we rolled back some of our reopening strategies for the economy due to the spike in cases. In San Bernardino County, which is where Loma Linda is in, was a part of that. And I think currently Riverside County, which is the county just adjacent to San Bernardino County, they've essentially stated that they're at about 100% ICU capacity at this point. Obviously, that doesn't include the surge capacity that you can do to expand ICU beds. San Bernardino County isn't as affected as Riverside, but we are adjacent. So we're about 50% capacity for COVID beds at Loma Linda currently. It might be a little higher now. That was a couple of days ago. You know, it'll just depend on the trajectory, essentially, in regards to the utilization of the hospitals, whether or not we ever get to a surge capacity. But we are still doing planned procedures. It's hard to, you know, in spine surgery and in neurosurgery, you know, we don't necessarily call them elective procedures per se, but they're planned procedures with different types of urgency, right? And you know, from our volume standpoint, when we looked at it from a practice, we're back on track to be at the same volume, but it'll remain to be seen if we have to cut back if the infection rates continue to go up.
Steve.
Great, thank you. Go ahead, Henry.
Yeah, so you know, I think there's a few challenges for us that I'm visualizing. One is the ramp up has been busy, and the government wants us to try and catch up to what was missed out. So what this may mean is operating basically weekends, after hours, etc. So for example, for the past 30 days, I operated 25 out of those 30 days on cases, and it's just been constant along with the trauma. The other challenge, I think, is trying to ensure that we have enough PPE as the volumes increase. So a lot of our PPE came actually from Michigan, our N95 masks. And so obviously Trump has certainly allocated that volume for the United States. So right now, one of the challenges is actually getting Canadian manufacturers online, and that's coming about, but it's still not fully there. And then lastly is this whole issue with the second surge. Like it could be a very real situation in the winter months. We always have flu season here in Canada, And I can see how, even if someone comes in with a sniffle now, that it will be treated like COVID in the winter months.
Thank you. There's a question from the
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.